everyone, this is Khyati Maheshwari and I'm so thankful to Dr. Kanu Kaushik sir for providing me this platform and making me a part of kinesioprehabinstitute. So today we are here to discuss about a very rare disease called Rett syndrome. Have you ever heard about PD management in Rett syndrome? Strange, no? But trust me guys, this works amazingly. So before starting with this video, let me just give an overview about what are we going to discuss today in Rett syndrome. We would discuss the general introduction, then we'll move towards symptoms, clinical feature, diagnosis, stages in Rett syndrome, and finally we would see the PD management in Rett syndrome. Okay, so now let's start with general introduction. The first question that comes to our mind is, what is Rett syndrome? So in very simple language, Rett syndrome is a genetical disorder that causes neurological and motor impairment. Genetical disorder. If someone has family history of Rett syndrome, then he or she, probably the she, is more prone to get Rett syndrome. Okay, and this is causing neurological and motor impairment. When we will study about clinical features and symptoms, we will come to know how it affects our nervous system and how it affects our motor system. Okay, then the next question is, what causes Rett syndrome? Listen carefully. There is a gene named MECP2 gene. You can simply call it MECP2 gene. It is basically responsible. It is responsible for producing a protein that causes brain development. And what happens in Rett syndrome? In Rett syndrome, mutation occurs in this gene, MECP2 gene, due to which protein is unable to form and brain development hampers. Brain development does not occur properly. Okay, and this gene lies on X chromosome. So the next question is, why this syndrome, Rett syndrome, is predominantly seen in females or girls? Since this gene, MECP2 gene, in which mutation is seen, is present on X chromosome, and we all know that females have got two X chromosomes, double X chromosomes, whereas males have got only single X chromosome. They have got X and Y chromosome, so it affects primarily the girls. Okay, then in case if it happens to be in a boy or a male, then he would die before 2 years of age group because of severe encephalopathy. In a boy, severe encephalopathy would develop as a result of Rett syndrome, due to which he would die before the age group of 2 years. What is encephalopathy? Encephalopathy is nothing but a brain disorder that causes structural and functional impairment in brain. Okay, and in females, every single female out of 10,000 females, Rett syndrome is seen. So it is a very rare disease, and if it happens, then the symptoms or the clinical features are seen after 6 to 18 months of birth, not immediately. Okay, this means the mutations are present since birth, but the developmental disorders or the symptoms would be seen after 6 to 18 months, and before that the development would be normal. Okay, so till now what all we have studied? We have seen what is the definition of Rett syndrome, what causes Rett syndrome, why it is predominantly seen in females, and what happens if it happens to be in a male and it happens to be in a female. Okay, then the next point comes, there was a Australian physician named Dr. Andreas Rett. She discovered this syndrome, so this syndrome is named after her, Rett syndrome. So basically Dr. Andreas Rett discovered Rett syndrome, and then there was a Dr. Bengt Hagberg. He told about the clinical features and causes of Rett syndrome. Okay, Dr. Andreas discovered it. Dr. Bengt Hagberg told about clinical features and causes. You can learn the name Hagberg by the name iceberg. Okay. Then there was a third person who told about this mutation thing, that mutation occurs in MECP2 gene which causes Rett syndrome. Who was he? He was Huda Zogby. Huda Zogby. Girls can learn this name by Huda Beauty, and males or boys can learn this by Zombie. Just you have to replace the M by G. Zogby. Okay. Huda Zogby told about this mutation thing. Fine. These three persons are there. Then the next point is, in India the first case was seen in 1994. Then the most important point, that is, this Rett syndrome is misdiagnosed as other diseases. What are those diseases? Autism, CP, cerebral palsy, and idiopathic mental retardation, because some similar features are seen in early stages. In early stages, some specific or predominant features are not seen in Rett syndrome. They are similar to these conditions, so it is misdiagnosed as these conditions. Okay. So what all we have studied? What is Rett syndrome? What causes Rett syndrome? Why it is predominantly seen in females? What happens if it occurs in males, and if it occurs in boys? Then who discovered it? Who told about the causes and symptoms? And who told about the mutation? Okay. And finally we have seen when it happened to be in India, and how and by what diseases it is compared with or misdiagnosed. So this completes our general introduction part.